Hello and welcome to Vaccinate India. This is a program which we do very closely with our partners at Google. The goal is very simple. We encourage you to vaccinate because that's going to save lives. And it's been a great week because for the first time we've actually gone above that 1 crore number. We need to be vaccinating at that number on a daily basis to ensure that we can vaccinate all adults, all eligible adults by the end of the year. But let's give you an idea of the vaccine numbers as they were, the vaccination numbers. Now, as of 3 p.m. today, we're looking at 17,18,620. So that number will rise by the end of the day. Now, again, you've got an idea of the total vaccination doses, and you've also got an idea of the breakup of doses. But let's just quickly move on to the record number of vaccinations. Now, this is the one I was talking about and this is very, very good news indeed. We have crossed 1 crore on the 27th of August, so that's very, very welcome news indeed. But again, the point is that we need to continue this. We need to be going like this. We cannot afford to go down. Already you see on one day we have done that. But what is encouraging in all of this is that the number of days that it's taken to get to 50 to 60 doses is 19, which is lower than it's taken for any period. So 1 to 10 doses took a whopping 84, then that started coming down, and so you're now down to 19 days between 50 and 60. Earlier 40 to 50 crore doses took us 20 days to get to. But let's just take a look at the vaccination equation in India, because in as much as we say that we've done well with 1 crore vaccinations on one day, we actually, and let's take a look at the number in millions. At the current rate of vaccination, 39%, just 39% of our population will be vaccinated by December. So the required vaccination rate presently in order to get to that 60% is 11.1 million doses a day. The actual number, this is the average vaccinations over the last 7 days, has been 6.4 million. And therefore the daily shortfall as an average has been 4.7 million doses. So that's what we really need to think about as we keep looking at this. But it has been a good day, and I think we need to reflect on that as well. But before we do that, let's take a look at the situation in Kerala. Now, this has been a cause of concern, and we'll be looking at the Kerala situation as well. As you can see, the number of fresh cases in Kerala is now over 30,000 cases for the 4th consecutive day. So why is this the case that Kerala, a state which was seen to be doing better than many others, has these high numbers? What is accountable for this mystery? That's going to be something we're going to look at in the second part of the program. But first we have a very, very special guest. R S Sharma joins us. He is the man behind CoWIN, someone who can really give us answers on how the app is going, how some of the future vaccination plans are shaping up. But sir, firstly, 1 crore plus COVID vaccinations is what we are now seeing a couple of days back. How did this register on CoWIN? Was it walk-in largely, or did people use their apps to register?
The way it operates, Vishnu, and I think there is a lot of confusion in the people's mind about this registration of CoWIN being necessary and mandatory for a digital journey. That's not correct. Actually, as probably I also explained earlier on your channel, that CoWIN is a platform which has a number of applications, front-facing applications. One of them is registration and scheduling application, where you can register and you can schedule your appointment. Another next stage is basically vaccination module, which essentially records the vaccination event. The third is recording the after effect, adverse effect of vaccination. Fourth is the certificate download. Fifth is where hospitals upload their timetables. So what happens if you don't register on the CoWIN? That's okay. You can just go to the CoWIN, the vaccination center, and there your details are captured and you are registered into the system. As of now, only 30% people are actually registering, and 70% are going walk-in vaccination. And that is because the situation about the availability has tremendously improved. Now the supply side is much more comfortable, and people feel confident that they go and they will be able to get the vaccines.
So just so that I understand, do you have a rough idea of how many were walk-in COVID vaccinations and how many, on this particular day were people who used the app?
Well, I don't have the exact figures, but the ballpark figure is about 70% people are walk-in and about 30% people are, through registration. Because in some areas where there is a more concern about the orderliness, etc., and where people still feel that it's better to go after getting the reservation done for yourself. They are doing the prior registration. Otherwise, people are normally going there aware. It is very mandatory, which we have made is for hospitals, both public and private, to upload the schedule of vaccination so that it's a completely, non-symmetric, there's no asymmetry in the information flow. So everybody is able to see their vaccinations are being done.
So is this a bit of a trend where in, let's say, the last couple of months, a larger number of people were actually walk-ins and fewer people were using the option to actually register?
No, absolutely. They are using, as I said, the walk-in does not mean that this is not a digital thing. At the second stage, you are captured. So it's a digital journey from that point onwards. But yes, the more and more number of people are now coming without registration on CoWIN. And of course, even if they don't register, that does not mean that they cannot get the certificate using their mobile phone or using Arogya Setu, because basically once they go and they get vaccinated using their mobile number, and that mobile number creates an account for them in the system, and thereafter they can download the certificate in case they want.
Now, sir, you were talking about CoWIN and the platform is also the entire issue of CoWIN as a digital passport. Now, that's very important, very different from what we're discussing, but also important, particularly for those who want to travel abroad. Now, you've already linked passports with CoWIN. So, for example, if I want to travel abroad, I can link my passport number with my fully vaccinated status, and that shows on my app. Unfortunately, the problem is that CoWIN is still not accepted as a vaccine passport in many parts of the world. Why is that the case?
That's a very good question, Vishnu, and let me explain it. There were initial attempt to have a multilateral agreement on this issue that every country's, passport, every country's digital vaccination certificate will be accepted as a passport, digital travel passport. But somehow that did not work out. Then, of course, there was another effort by the International Civil Aviation Organization to basically, have such kind of for air travel. And that is a work in progress. That discussion is going on. Then there is an attempt now on a bilateral basis. You want to have I accept your country's passport and you accept mine. So those discussions are going on with our Ministry of External Affairs and those countries. What we have done, we actually satisfy our digital, certificate of vaccination from the very beginning. We have aligned it with the international standards. So our thing is absolutely, we have a public key, private key. The QR code is encrypted. The information which is required on a passport is actually there on the digital certificate, vaccine certificate. So we have created a packet of all the information, and this packet is given to the Ministry of External Affairs. We are also participating. Ministry of Civil Aviation is also, sort of working with us.
Right.
So we are wherever and whenever those agreements get finalized, we are very much consistent and aligned with the international standards of vaccine, passports.
So what about RT-PCR tests? Can these also not be attached to CoWIN, because that's a requirement as well when you travel abroad?
Absolutely. Wonderful question again, Vishnu. What we are doing is we are working with the DGICMR, and we already have developed a system like you can, download the CoWIN certificate. Similarly, now you can download the RT-PCR certificate, digitally signed, and actually we are through with that journey. Now, what we are trying to do is basically a single entry point for any citizen where he or she can download his or her CoWIN certificate, vaccination certificate, as also RT-PCR certificate. So that is also happening in a week's time or 10 days time. So I think we are now able to generate digitally certified, signed certificates, both for RT-PCR and of course CoWIN was already there. Now we are integrating those at our front end.
So in simple terms, if I was to travel abroad, and for example, many countries, most countries in fact, require an RT-PCR test 72 or 96 hours prior to traveling. If I go to the airport and the airline says, have you done an RT-PCR test, would I in the next few weeks be able to click on CoWIN, show them my app and say, look, here's my RT-PCR test and here's my vaccination status, and therefore I'm good to go?
Absolutely. That's what we are working towards, and that should not take more than 10 days time now, because we already have RT-PCR test, digitally downloadable certificate available. So I think what will happen is probably we'll provide a single, sign on for a person to essentially download both the certificates and show it on their mobile.
So also I believe you're working towards a system where the vaccination status of children will also be digitally available and recorded. Is that vaccinations or all vaccinations or COVID vaccinations?
Well, the COVID vaccination is naturally, this platform itself will be able to take care of that. There's no issue on that. In fact, if you recollect, a lot had changed since the day we began the vaccination. It was for 60 years plus, and then it became 45 years to 60 years with comorbidity, then 45 years, and now 18 years. So these parameters have continued to change. So same parameters can be plugged in again into CoWIN to basically take care of children also. But I think the larger issue which I think you are referring to is whether a normal immunization program, this particular platform can be repurposed to actually track and trace immunization program in the country. And the answer is yes. Our Honorable Minister has actually directed us that we should repurpose the application, the CoWIN platform, to take care of the immunizations in the country also, because that will make it much more, trackable and much more, we can follow it up. Because once you have a child immunized and, suppose that there is a second dose which is falling due at a certain point in time, then, we can continue to inform the parents and the guardians to say that your child's second dose is due on that part, and whosoever is the government officer, which is ASHA worker or anybody, they can also be simultaneously informed. So I think that will ensure a much better, monitoring mechanism and a much more scientific monitoring mechanism for immunization.
Absolutely.
So I think we are working on that.
And to have a digital record of all vaccinations would be fantastic. So the CoWIN application can go well beyond just COVID. Thank you so very much for being with us. Lots of fantastic ideas there. Let's see how it all works out. We're going to take a short break. Remember, COVID is by no means over in India. The situation in Kerala remains one of concern. We'll try and understand why for 4 consecutive days the number has been above 30,000 cases. We'll take a look at that coming up. Welcome back. For the last 4 days, we've seen the numbers in Kerala have 30,000 fresh cases of COVID. That's a matter of huge concern. Why are the numbers so high in a state which was seen to have been doing perhaps better than other states or many other states in this country? Joining us now, Dr Rajeev Jayadevan, Senior Consultant and Gastroenterologist and the Deputy Medical Director of the Sunrise Group of Hospitals in Kochi, and Dr Anish TS, Medical Expert on the panel for COVID-19 in Kerala. Thanks very much for being with us. Dr Anish TS, let me ask you this first. The large number of cases that we are now seeing in Kerala, are these individuals who've had at least one vaccination? Because Kerala has had a relatively high number of first doses.
Actually, it is an interesting case that almost 25% of our population has got 2 doses of vaccination. And according to the available data, they constitute only 3% of total infections. And if I do not have the real data for in case of people who got 1 dose of vaccination, but it is very clearly saying that 25% of people who got 2 shots is contributing only 2 to 3%. That is available. It's actually very much similar to the European data. That means even if there are some chance of breakthrough infections, the vaccines are going to help you out from preventing infection. And as we all know that vaccination is going to reduce the severity of diseases and it is going to prevent deaths. If you look at the number of hospital beds filled and ICU and ventilators occupied, you can see that it is somewhere around 60% of the state's capacity in the southern districts, and it is somewhere around 70% of the state's capacity in the northern districts.
Okay.
Even if the daily number of cases is 30,000 and our TPR is somewhere around 17 to 18, we are not seeing that much severe cases in our hospitals. Definitely that is because of vaccination.
So just Dr. Anish TS, just one small clarification. You're saying that the severity of the cases is relatively low, but in terms of the cases themselves, are these individuals with one vaccination? I take your point about the importance of 2 vaccinations, that goes without saying, but are a large number of people who are in hospital or unwell, have they all got 1 dose, a large majority?
Actually, I do not have the state's data on that, but I have got the data from Trivandrum Medical College. And among the people admitted at Trivandrum Medical College, 60% of them are not having any single vaccinations.
Okay.
Maybe
so
another 25. Yeah. So so vaccination is going to help you to reduce numbers, and we know that it is going to help you to reduce severity and deaths. Definitely, there is no doubt about that.
Dr. Jayadevan, the question which many people, including people in Kerala, would want to know is, why is Kerala having this surge now when so many other parts of the country, Maharashtra, certainly Delhi, UP, Bihar, Karnataka, have had our bout of Delta, and terribly so, but a couple of months back. Why Kerala now?
Well, when you seek answer to that question, the commonly heard explanations, I prefer not to repeat them because I think most of our viewers know that. For instance, the number of people who are naturally infected in Kerala are lower, the early mitigation strategies worked, and so on. So let's just go on to some basic science here. Let's just try to answer the question from a strictly scientific standpoint, not from a state standpoint. Why does a virus spread? And it spreads based on what is called the agent-host environment triangle, and that's called the epidemiological triangle. That's common for all infectious diseases, whether it's cholera or tuberculosis or SARS-CoV-2. Agent is a virus, host is human being, and environment is what separates the agent and the host. For cholera, environment is water, and for SARS-CoV-2 virus, environment is air. And for the most part, we know very well that this is an indoor air spreading disease by now. Agent and host are pretty much the same for all of the country. There's the same virus, same Delta variant, so let's just leave the agent out of this. Host, maybe slight differences in terms of proportion of vaccination coverage and so on, but still, I think the increased vaccination coverage of Kerala will average out the relative decrease in the natural immunity.
So
let's say,
why the delay in getting this in Kerala?
Yeah, so the question is that leaves out the environment. What is it that makes the virus spread between people? See, in discussions, we frequently forget to discuss why transmission is greater in some regions. And remember, the virus has to physically travel from one person to another, and that travel doesn't happen on its own. It's through droplets. And droplets survive longer in certain conditions. Just look at Colombo right now. They're having the exact humid, rainy conditions we are having now in Kerala. They're going through a major surge right now. So I don't believe this is really a Kerala problem, more of a region.
That said, I take your point. But there are other parts of the country which are equally humid. West Bengal, for example. Now, we may not have as reliable statistics from West Bengal as we do from Kerala. Or even Tamil Nadu has had a serious number of cases, but not to this extent. And these are humid areas in the middle of the monsoon. Goa is exceptionally humid, but they've had their sort of their tryst with Delta a few months back. Right?
Yeah, we must not make the mistake of blaming everything or pointing everything at one factor. This is a multifactorial disease.
Sure.
So I'm trying to point out the multiple variables. Why does a storm occur? A storm occurs when multiple variables coincide at the same instant, and that's when a storm occurs. Likewise, transmission also occurs in great numbers when multiple variables occur. For example, Kerala, I think they started with a baseline of around 20,000. Now they are up to 30,000.
Sure.
For 20,000 cases to become 40,000, it only takes a week or
That's
even
true. So
smaller.
I'm interrupting because I'm running short on time. I just wanted to ask
Yeah.
Dr. Anish TS one more question. What about Onam and the fact that there was laxity in Kerala? Unexpected, but it did take place. Are these numbers attributable to social distancing disappearing in many cases?
Definitely, Onam has played a role in increasing the number of cases, no doubt about that. Because Onam, rather than a holiday or a festival for a single day, it is a seasonal festival. We have got many Onam days, and it might have contributed large number of cases. Definitely, our numbers were shoot up by 10,000 maybe on a fine morning because of Onam, and our TPR was raised by at least 3 percentage points because of Onam. And definitely, their Onam is a reason for that. But I think government of Kerala was allowing some kind of interaction because they want to keep the business and livelihood of people live. Because Onam days maybe is the season or the time where almost all the people are going to earn something. And that may be the reason that the government of Kerala was allowing some kind of interaction at this point.
But allowing that interaction at a time when the science is absolutely clear, without social distancing, all of us have had it. That perhaps was unfortunate. In fact, the Supreme Court also made certain observations. I'd like to leave it at that for the moment, gentlemen, but these numbers in Kerala are worrisome. Let's hope that the numbers plateau for a few days and then start coming down. Out of time on this program, more coming.